Beetroot is super great for hypertensive patients. So for people who are very young, instead of recommending hypertensive drug for them that it will live all through their life, it's better you introduce lifestyle modification for them. And beetroot has been one of the most powerful fruits I have used successfully to help people living with hypertension.
So what does beetroot do exactly?
Okay, it contains nitrates and it helps to dilate the blood vessels, thereby increasing blood flow to the heart. That's how it works. And again, it actually contains iron for people who are anemic. Like I recommend it for most women. Every month we see our period and we lose iron. So I recommend it for a lot of women because beetroot contains iron and we need blood.
Okay.
Yeah.
Now, for someone who is probably diabetic, what would you recommend, fruits-wise?
Good. For someone who is diabetic, we have different categories of fruits. You understand? Now, under fruit therapy, we have the juices, we have smoothie, and then we have fruity.
Smoothie? Wow.
Yeah, we have smoothie. So people who are diabetic, it's better for them to go on smoothie. And fruit that has low glycemic index. There's something called glycemic index. It's like a measuring scale you use to measure the amount of glucose in a particular food. So for diabetic people, we have something like cinnamon, cucumber, and garden egg. These are the three powerful fruits or smoothie you can use for people who are diabetic.
Cinnamon, cucumber, and garden egg.
I
would
in
never
a smoothie?
guessed.
Yes.
In a smoothie?
Yes.
All right.
It's super great because cinnamon increases the insulin sensitivity in the body. Cucumber is very high in fiber. Then garden egg also contains what they call chromium. Chromium is very important in terms of diabetes.
Now,
okay. I wanted to talk a little bit about fertility now for both men and women. So for those who have probably been going back and forth to the doctor about being a little bit more fertile, what sort of fruit would you advise for them?
Well, in terms of for women, fertility issue has to come with hormonal imbalance. So we advise a healthy eating pattern, but there's something called seed cycling. Many people don't know about it. Seed cycling is when you use different types of seeds to help women balance their hormone. Once the hormone is balanced, definitely fertility is going to take place. We have seed like chia seed, we have seed like sunflower seed, pumpkin seed, and there's another particular seed I can't remember. So the way you use it is for a particular month, like 1 to 14 days, you use sunflower seed and pumpkin seed in your smoothies. Then 14 days to 28 days, you use the other two seeds, chia seed and one other seed that I can't remember. You understand? So when you do that, you add it to your smoothies. Then there's this particular fruits people don't really know about that helps in fertility. It's called gorontula. People call it kayamata.
Locally,
it's super great for fertility, yes, among women. Then for men actually need a lot of zinc for fertility. And that's where your watermelon comes in. The back of your watermelon and the seed of your watermelon, they are super great for men.
When you say the back, like the back,
yeah,
the green
of
back.
I don't throw the back of my watermelon.
What? Are you serious? What do you do with it? You turn it into a smoothie or you chew it?
You can use it to make juice. For you to use it to make tea, all you just need is to cut it and boil it for 10 minutes. Then you drink. If you drink it at night, most men who drink it at night, they get erection in the morning. It's super great because it contains citrulline and zinc that helps for blood flow.
All right. So now that we've talked about all of this, some people will be like, they want instant cure, which is why many people would rather go for surgeries than using medicines. Do these fruits actually help cure, or they just help to manage it?
Okay, now as a nurse, from the orthodox aspect, there are some medical conditions that we advise you go for surgery or you go for a short-time treatment. Because when it comes to chronic condition, I advise you go on a lifestyle diet, which is the fruit therapy. It works. It works. My journey started 6 years ago when I helped a woman with ovarian cancer. So it works very well. But the only thing is you have to believe. Because most people don't believe. I've had patients that they came with blood pressure of 200 and something over 100. And within 1 week or 2 weeks, it became 130 something over 70.
And
just because they believe. And most of them
faith in it.
Yeah, faith. And most of them don't understand that this thing, I'm a nurse, so I give people medication. These things in our fruit, they are the same thing they use in making our medication.
True.
Yeah. So everything is just about balancing your lifestyle, your diet, and also believing in nature.
You know why I asked? We mentioned high blood tension. We also mentioned diabetes. Now, these are diseases that people believe have no cure. So that's why I was wondering, like, if you maintain this diet for the rest of your life doesn't mean that you have it under control. You're cured of it at some point.
100%.
Is it cure or under
cure? You know, in medical line, as a nurse, we don't use the word cure.
Of course.
Yeah. You understand? But what I tell people is this: when you see result, when the food is right, then there's no need for medicine. True. So you cannot start a therapy, you are getting result. Why is the need for going back to medication? So definitely you're fine. But the moment you step back or you start doing the same thing you were doing before you got the problem, definitely it's going to come back. So it's just a lifestyle thing.
I believe in preventive medicine anyway, so one might as well start.
I was just thinking about, so when I was a child, my mom went through some serious arthritis. She used to type. She used to be a typist. So her fingers used to be stiff, her knees used to be stiff. And there was a doctor that recommended some fruits. I can't remember the names of those fruits, but I know you probably have a few of them in mind.
Do you know that blood group diet has a lot to do with diseases? For example, I had a client, she was A positive. Do you know the major cause of her arthritis was because she was eating tomatoes? Wow. The fact that a fruit is okay doesn't mean it's good for your blood type. So maybe what the doctor did was eliminate something from your mom diet, then include
something else that works
something else that balanced it.
Wow.
So that's the way the body works. So another man food is another man poison.
Tomatoes, like
yes,
honestly,
of course, for A positive.
Wow.
Then for O positive, most O positive people, they have this ulcer. Most of them, if you ask them, they say, oh, I have ulcer, I have ulcer. Okay, it's because most of them, they have what they call high stomach acid in their stomach. So if they don't eat according to their blood group, definitely there will be an imbalance.
What about B positive?
I'm B positive. What some of the problem we have is hypoglycemia and constipation. You understand? Hypoglycemia means sometimes your sugar level just go down.
Bam.
Bam.
Yeah, and then you have to take something
so you have to watch what you like. Me, I don't do well on milk. B positive people, we don't do well on milk because we don't have enough lactase to digest. You know what? The lactose in the milk.
I actually feel like those watching right now should go on Twitter right now. Go to our hashtag Wake Up Nigeria on TVC and actually mention maybe their blood group and you know, and see what sort of fruits they should be taking or are better suited to them, so we can try and help a lot more people out. Because this information is so key, and these fruits are so readily available all over.
Like the tomatoes you mentioned, for example. So we've established that for A positive it's best to avoid it, but for B positive, what fruits should you avoid?
Okay, basically we just have very few fruits that some blood group can avoid. Like for O positive, it's better you stay away from oranges. Remember, I already said you have high stomach acid content. So if you keep taking fruits that are acidic outside the body, though when they get into the body, they become alkaline. But the moment you take it, before it gets to your stomach, it becomes more acidic. So you can disturb them. They can have things like acid reflux. Now, for B positive, it's better they avoid pineapples. You understand? Because there is a particular content called lectin that can also have issues with their blood. But for every other fruit, it's perfect. You understand?
You know, there's this issue of people drinking a lot of juices, especially things like pineapple juice. And I was told once before that drinking pineapple juice is actually increasing your blood sugar.
Exactly.
Talk to me about this. Talk to us.
Now, when it comes to blood sugar, every fruit or every food has sugar. Now, when it comes to juices, when you take fruits that have, remember I talked about high glycemic index. Now, for pineapple, it's more than 55. Anything more than 55 is high. So when you take the juice, there is a surge.
See, I really want you to just keep teaching us about this. Yes. We know we've learned a lot from you. And we'll also like to give you something in return. And that's breakfast.
Head to the
Hopefully, there's nothing that will make you constipate in there.
No.